What a time to be in DEI. Inclusion, belonging, equity. Who would have thought that these words and their definitions would be used against the very folks working to create more inclusive environments in their communities and states? After the murder of George Floyd in 2020, we saw organizations across the country in all sectors make commitments to strengthening their diversity, equity, and inclusion efforts. However, in the following years, we've also seen record legislative and social pushback to equity efforts, with many organizations falling short of completely abandoning commitments made. Protection that groups have fought for and won in the past are being repealed, from reproductive rights to affirmative action. We've seen the polarization of policy, with leaders restricting the use of DEI policies, such as Governor Abbott of Texas, who in February 2023 directed state agencies to stop using DEI policies. Independent newspapers, the Texas Tribune, reported that Andrew Eckhouse, an Austin-based lawyer for a Kaplan law firm, which specializes in employment and civil rights litigation, said that the governor's office was completely miscategorizing DEI's role in employment decisions in an apparent attempt to block initiatives that improve diversity. As Eckhouse acknowledged, DEI initiatives work in tandem with existing anti-discrimination laws to encourage companies to solicit applications from a wide range of people, and this benefits us all. Months later, the impact of this directive was troubling. DEI offices on campus were dismantled, and chancellors reported that recruiting faculty became more difficult. And that's because, according to the Pew Research Center, most people support DEI efforts at work. The 2023 survey comes at a time when DEI efforts are facing some backlash, and major companies are laying off their DEI professionals. 56% of employed adults in the U.S. say that focusing on DEI at work is a good thing, compared to a neutral 28%. 16% say DEI at work is mainly a bad thing. So what are we to do with this mixed message? It can be challenging to continue our equity efforts despite the pushback, but we know this noise is a distraction, the response of a privileged group when that privilege is challenged. We can stay committed to the principles that are proven to improve health disparities for those most affected by discrimination, bias, and racism. The most effective DEI efforts use the theory of target universalism, the idea that everyone benefits when the most marginalized groups are considered. According to a primer published by the Haas Institute for a Fair and Inclusive Society at UC Berkeley, target universalism is an approach that supports the need of a particular group, even the politically powerful or those in the majority, while reminding everyone that we are all part of the same social and civic fabric. You may have seen a version of this image. The fence imagery aims to distinguish between equality, meaning strictly equal treatment, and equity, or fairness. In the equality version of the image, people of different heights and abilities are given equal-sized boxes. But we can see the same box doesn't help people who are different see over the same fence. Targeted universalism does advocate for different people receiving different strategies or resources, but we can gather that's necessary for everyone to meet the universal goal, for everyone to see. So the larger question may be, how do we remove the fence? That would allow the most people to experience the gain. It's a solid metaphor for structural change, something more durable that benefits everyone. In 2020, NICHQ hosted a series of webinars focused on health equity, culminating in the introduction of the Equity Systems Continuum. an evidence-informed conceptual framework developed in partnership with the Global Infant Safe Sleep Center. It describes and defines the systems that individuals and organizations currently operate within. In this framework, the systems are defined as supremacist design systems, savior design systems, ally design systems, and equity empowered systems. Supremacist design systems, regardless of the intent, maintain inherent structural biases, reinforcing and perpetuating inequities that have long been entrenched in institutions, policies, and community relations. Savior design systems were originally designed to rescue, save, or deliver services to historically marginalized communities by members of the oppressing communities. However, these systems do not consider the root causes and institutions that create marginalized populations in the first place, and include policies and practices that harm specific racial groups while benefiting or centering others. Ally design systems acknowledge limitations of the overall understanding of disparity groups' experiences, but do not use these experiences as a reason to act. These systems reflect on lived experience, points of privilege, and oppression to inform additional perspectives needed for discussion and decision-making, and they attend to identify and challenge institutional and systematic oppression. You might hear this description and think, this sounds pretty good. While many ally design systems are well-intentioned, these systems often create environments with paternalism, tokenism, and monological approaches that don't include voices of disparity groups, leading to work that is not reciprocal, reflective, or truly participatory. As we think of this continuum, our goal is to create equity-empowered systems built and governed to center on experience of disparity groups. These systems accept racism and other forms of oppression that adversely impact systems of care and pay specific emphasis on addressing unique needs and root causes of inequitable outcomes. Equity-empowered systems deconstruct institutional racism and systematic oppression and reconstruct systems that are rooted in advancing equity of historically marginalized groups. In an equity-empowered system, there is shared power, diversity representation, and a redistribution of resources to establish equitable decision-making, design, and implementation processes. By mapping this continuum and giving each system a name and definition, we can consider where our current approaches have succeeded and failed, and what we need to do to improve. This framework can give us a tool and additional language to assess our surrounding and navigate the current DEI landscape. We are already seeing indications that 2024 will bring continued legal challenges to the ways we do DEI work. From errant billionaires tweeting their "I'm rubber and you're glue," messages of refusing to call racism what it is, to the power of lobbying, one thing is clear. We will need to pivot too, because at its heart, this important work to ensure that access really is equal, that the color of your skin shouldn't determine whether you live or die while seeking medical care, support from services like law enforcement, or simply existing in public, DEI benefits us all. Despite what impression the noise is trying to generate, the data show that most people believe DEI-related policies and resources have had a positive impact at their work, including hiring policies, affinity groups, transparency around salary, dedicated DEI positions, and workplace trainings. Let us stay the course together, sharing our challenges, successes, and strategies for moving toward these universal goals of access, opportunity, and health.